It is generally accepted that autologous ear reconstruction using costal cartilage in microtia or anotia is generally performed after 7 to 8 years of age. Let us see the reasons why. So the external ear reaches about 85 to 90% of its adult size by the age of 6 to 7 years. So performing the surgery after this age allows the reconstructed ear to be appropriately sized in proportion to the child's head, face and the other ear. If the surgery is performed too early, the ear might not match the size of the other ear, as the other ear is going to keep on growing and the reconstructed ear might not grow with the same speed. So this can lead to an asymmetrical appearance. The second reason is by the age of around 7 to 10 years, the rib cartilage has usually developed enough to provide an adequate amount of cartilage for reconstructing the ear. So if we do our surgery before that, we might not have enough cartilage, which can lead to suboptimal outcomes. Also, it is important to note here that each child is different, and in some kids the cartilage may be developed adequately at 7 years. In some it might take 2 to 3 more years for that cartilage to develop. So this call needs to be taken as per individual assessment of that particular patient. Now, the third reason is older children are generally better able to understand and cooperate with the post-operative care, like not to bear weight or not to lie on that side of the reconstructed ear in the post-operative period, and even in the pre-operative counseling as well. So these couple of instructions, older children are better able to understand and better able to follow. So these are the couple of reasons why autologous ear reconstruction in microtia is performed after 7 to 8 years of age.